results of our current, very recently released research project, I wanted to start by giving you all a little bit of some history. And that history goes back about 7 years ago when CFHS was contemplating its strategic plan and went out to the member societies to ask what are the issues of topmost concern for you that you wish the Federation to be working on at the national level. And overwhelmingly, the answer that came back was cat overpopulation. So this is the situation where there are more cats than there are homes available to take them in. And a situation that manifests in many organizations in shelters being overburdened with a very large number of cats who need to find homes, who may not be in the best place, and ultimately may end up seeing high euthanasia rates. So very devastating consequences. As a result of this, we decided to undertake a program of work called Cats Count in Canada. And so this involved initially striking a national task force on cat overpopulation composed of our members from across the country in every province of the country. And together, the task force contemplated what should be done to address this crisis situation in Canada. And the initial basis is a better understanding, an evidence-based approach to understand what is the situation. So the task force decided to create a national stakeholder survey in order to ask stakeholders who are dealing with cat overpopulation issues manifestly, what is your experience? What are your perspectives on this? And what is going on in the country? The CAT task force then put out this survey to veterinarians, municipalities, SPCAs and humane societies and rescues, of course, as well as spay-neuter groups and trap-neuter return groups who were working on these issues. And as a result of this very comprehensive approach, in 2012, the Cats in Canada research report was released. It provided results on the situation across the country, and it garnered a tremendous amount of positive reaction, including hundreds of media stories raising attention to this issue in the country and bringing attention to the issues of cat welfare. On the basis of this report, CFHS and its task force members then engaged in provincial stakeholder meetings across the country, bringing together those very stakeholders who are working on cat overpopulation together to collaboratively discuss, on the basis of the research findings, what could be done to take action. And a number of local and provincial action plans arose from those very productive and collaborative meetings. In addition, CFHS continued to work on this issue and extended its program of work on a three-pronged approach. First of all, working to promote accessible spay-neuter as the root solution to overpopulation. So looking at how to make and advocate for spay-neuter services that are affordable and available as much as possible. Secondly, hosting Just for Cats festivals across the country with the purpose of elevating the status of cats in Canadian society, as well as celebrating the human-feline bond and continuing to raise public awareness on cat welfare issues. Thirdly, providing evidence for a shelter management model called Capacity for Care, which had been identified in the report as a critical piece to address the welfare of cats within shelters themselves. And so we worked together with our partners at the University of California, Davis Court Shelter Medicine Program, and 6 of our members who bravely stood forward to test out this approach in their shelters. And we produced findings that 6 years of pilot studies resulted in showing that indeed capacity for care has amazing benefits to both the cats as well as the people in the shelter, as you'll hear. I want to just take a moment and tell you a little bit about capacity for care, because we are going to be talking a little bit about this through the course of the presentation. And so for those of you who aren't familiar, I hope most of you are, but for those of you who aren't, there's some key aspects with this innovative approach to sheltering cats, some of which include optimizing the number and flow of cats moving through the shelter in line with the shelter's true capacity to meet their welfare needs. Secondly, providing high-quality housing to meet the Association of Shelter Veterinarians guidelines for standards of care and to provide for the welfare needs of those cats. Thirdly, to aim to reduce the length of stay of those cats within the shelter environment, because we need to ensure that their stress is minimized so that they don't get ill, and so that euthanasia does not become their outcome. And so, as you can tell, these aspects definitely have improved outcomes for cats. But what's really interesting is that when shelters talk about going through capacity for care models to address these issues for cats, they've also talked repeatedly about the effect that that has on the shelter atmosphere, culture, and morale. And that may sound very intangible, but in fact, we hear over and over again that it's a feeling that comes out that is sensed by staff, by the community at large, and by adopters who are coming through the doors. And ultimately, the shelters find that they're no longer overwhelmed and overburdened by having so many cats in the shelter. And so we see that not only do we have better outcomes for cats, but we have better outcomes also for the people who are working in those shelters. So we're going to be hearing a fair bit about capacity for care over the course of this conference. And I think I just want to let you all know that the final report on those 6 pilot studies, the 6 shelters that stepped forward to put this in place, will be coming out very shortly in both French and English. And so, where does that leave us today? Through the course of all of this work that CFHS undertook to improve cats, there was a commitment to go back 5 years after the publication of the initial report in 2012 and to see what was the effect of all of that work. What is the impact, and has there been improvement in cat overpopulation given all of the attention and collaborative work that's been taking place through the sector and through animal welfare organizations? And so as part of this approach, that's exactly what happened. In 2017, the CAT task force was restruck, and they put together an approach whose methodological approach was the same as was done in 2012 in order to be able to measure change. And at the end of 2017, the 5-year overview of overpopulation was released. And I'm happy to say that it's now also available in French. At this time, I want to mention the incredible organizations who provided the funding to make that 5-year study possible. Firstly, the Summerlee Foundation, who has been a long-standing supporter of CFHS's cat work. Also, however, BC SPCA, Edmonton Humane Society, Toronto Humane Society, and Winnipeg Humane Society. So we're very grateful for their thinking in and their commitment to measuring change in order to be able to bring that evidence basis. So, as I said, we reconvened the cat overpopulation task force. And this time we were able to bring together members from every province in Canada with the exception of Newfoundland and Labrador. And so this slide just provides you with a list of those amazing, committed people who worked together to, first of all, ensure that the methodology and the approach that we wanted to take was consistent, to be able to work quite hard to collate contact lists for stakeholder groups within their province so that we could go out to the stakeholders with a follow-up survey, and then to bring their regional perspectives to an understanding of what the research actually showed and how to interpret that. So these folks, many of whom are here at the conference, you'll be able to have some discussions with them over the course of the next few days, I hope, and to hear from their perspectives, and I want to thank them again. So I'm going to start to jump into the findings of the report very shortly. But before I do that, I wanted to put a couple of questions or a couple of thoughts out there for you to keep in mind. And the first is that through the course of conducting the survey of stakeholders, we were able to ask for stakeholders who are caring for animals directly about results that they see for cats in their care as well as dogs in their care. And you'll be seeing some differences presented through the data that I'll show you. And so what I'd like to keep in mind is that in many cases where there are differences, do we think that cats are receiving the same care and consideration in Canadian society as dogs, given that those species have, particular needs? And the second point, perhaps it's a bit of a spoiler for those of you who haven't yet delved into the report, but essentially we are seeing some positive outcomes, some positive change on the front of cat overpopulation. But despite tremendous efforts on the part of many of your organizations and many organizations working in this area, cat overpopulation persists. And so what do we need to do at this stage to move ahead and to move forward with that? Where do we go from here? Okay, so as we move ahead, I'm going to be going through a lot of data, as I said. I'll try and do some summarizing at different times. As well, I'm going to be making or letting you know about some of the recommendations that arose and that were published in the report. And at the end, I'd like to take a few minutes, I hope we'll have time, to turn it over to you and to ask, what do you think? And so hopefully we'll have some feedback. The first part of the cat overpopulation study involved a general population survey of Canadians. So we contracted Ipsos, the research firm, to use their online omnibus poll. And they reached out to 1,222 Canadians, 18 years of age or older, in 10 different provinces, in order to create a representative poll of the Canadian population, representative in terms of age, gender, and region. And the first series of results from that general population survey that I'll show you really is about cat ownership, pet ownership, companion animal issues. So here's the first one, pet ownership in Canada. The survey found that 62% of Canadians own at least one pet. And if we look at the parts of the graph here, this is broken down by species, by companion animal species, cats, dogs, fish, birds, and other species. And it becomes very clear that the most popular companion animal pet is the cat, with 36.9% of Canadian households, including a cat in their family, at least one. Dogs come in at a very close second. 35.2% of households include at least one dog. And then quite a bit further back, we have the other species. In those pet-owning households, 1.6 cats is the average number of cats in each cat-owning household. And for dogs, it's 1.4 dogs per per dog-owning household. And so just for information, that number, 1.6 for cats, is down a little bit compared to 5 years ago. And the dog number is very similar to what it was 5 years ago. This summary just reiterates the same numbers on the second line as I just showed you, 36.9% of households owning a cat. This is essentially the same, maybe down just a little bit compared to 5 years ago. And we've seen a little bit of a change for dogs, so slightly more households who include a dog in their family. When we look at the characteristics of the cat-owning households, we find that householders who are younger than 55, as opposed to older, are more likely to be cat owners, and those with children are more likely to be cat owners as well. So given that the survey is a representative of the Canadian population, we can infer from the survey the number of owned cats in Canada, and that number is 9.3 million in 2017. And that's down a little bit compared to what we saw in 2012, when it was about 10.2 million. The next area of question was about where are these companion animals coming from? What is the source of owned cats? And the results here are very similar to what we saw 5 years ago. By far, folks are getting their cats as giveaway free. They're receiving them from friends or relatives, or they're taking them in, finding them as strays. So these three largest categories are essentially freebies. Whereas the two categories over here are showing that in total, 27% of owned cats are acquired through adoption from humane societies, SPCAs or shelters, or rescues. And so that is just one fraction of the source of pet cats. Other smaller sources include pet stores, breeders, animals who are purchased through an ad, etc. So that tells us where people are obtaining their animals. The next question speaks to what fraction of companion animal owners are actually having their animals spayed and neutered. So what we found in 2017 was that, on average, 94% of cat owners report that their animals have been spayed or neutered. And that's a really interesting increase compared to 5 years earlier, where the number that we saw was 80%. So I think there's a couple of things that I'd like to point out with that result. And the first is that there's actually a correlation between income level and the likelihood that somebody would respond yes to the question, have you spayed or neutered your cat? And this is very consistent with findings from other regions and other studies where there is a correlation between income level. And so this 94% is for the entire demographic or the entire survey poll, whose income level is 66,000. However, if we specifically look at the demographic slice whose income level is at 100,000 or higher, then we find that this number goes up to 99%. So clear differences there. As well, it's worth considering what that means when people who are responding to an internet-based survey may not necessarily be at socioeconomic levels that would preclude the access to spay and neuter, whereas I think we've seen that those who are in need of more veterinary access are often in lower socioeconomic tranches. The other piece that I want to point out is that this is one of those instances where there could be response bias, where individuals might know what the socially acceptable answer to give in this survey would be, and they may say, well, yes, the right thing to do is to spay and neuter, even though I haven't quite got there yet and haven't done it yet. So these are some caveats that we need to keep in mind. The next area of questioning was about how owned cats spend their time. And I was pretty excited to ask this question, which essentially is, do you allow your pet cat to go outdoors, completely unsupervised, supervised, or do you keep your cat indoors? And what we found was that 56% of respondents indicate that they kept their cats indoors all the time. 16% allowed their cats outdoors, but always under supervision, and 28% responded that their cats were allowed outdoors at some time without any supervision. So once again, I would say that there could be some response bias here as well, where there might be some pressure to give the socially acceptable answer. But nevertheless, I think these are some really interesting findings about the movement of how people are caring for their cats. So I'd like to move on now to the second larger piece of the study, which involved the National Stakeholder Survey. Once again, we targeted the same groups, the same stakeholder groups, as I mentioned, were targeted in the 2012 survey. And we wanted to pose the same questions as was asked 5 years earlier in order to measure change over time. So just to say again that the task force members were the ones who, in their provinces, put together the contact list for their stakeholders. In the case of Newfoundland and Labrador, where we didn't have a task force representative, we had a wonderful board member from CFHS who was from Newfoundland and Labrador who did that work for us. So the task force members collated the list of contacts in their provinces. CFHS also added some of the contacts to their, from our lists into that pool. And so we reached out to that list of all of these stakeholders across Canada that we are aware of. In addition, for the veterinary group, we reached out through the Canadian Veterinary Medical Association and some of the provincial veterinary medical associations to ask them to distribute to their contact lists. And in the 2012 survey, it turned out that we didn't have quite as much municipal representation as we wanted to see in, based on the fact that municipalities have an important role in companion animal welfare and sheltering, et cetera. And so we reached out also to associations of municipal administrators and enforcement and asked them to distribute the survey as well. And the results shown here are, you can focus on the middle section here. This is, in 2017, the stakeholders who responded to the survey. So up at the top, 309 respondents in total, and then we break it down by stakeholder group. And for most of the stakeholder groups, including Humane Societies, SPCA's, rescues, and some of the other groups, we see very similar responding numbers. I just want to point out that some of our efforts in engaging more municipal responses did bear fruit. And so some of the two differences that we see in the overall makeup of the survey respondents this time around included a greater representation of municipalities, so they made up 39% of respondents, and a decrease in the number of veterinarians who responded. In that case, we were okay with having few representatives from the veterinary population, just because in the survey that was conducted 5 years earlier, we saw actually quite a large number of vet respondents, and perhaps they were overrepresented. Okay, and so we started off on some questions to this group of stakeholders as a whole, including what is your perception of the cat overpopulation problem in your area? Overall, stakeholders responded by saying, about almost 2/3 saying that yes, there was an overpopulation problem. And perhaps one might think that this is a little bit lower than what was given, the answer that was given 5 years earlier. So for many of these graphs, I'm just going to show you overalls, but then break down by stakeholder groups, because it's really interesting to see how the different groups are considering and responding to these same questions. In general, we, across the board, see a little bit of a decrease in the perception that there is overpopulation taking place in their communities across the stakeholder groups. In particular, I want to point out that municipalities have responded that only 38% of respondents from the municipal group believe there to be a cat overpopulation issue, and that is a little bit lower than 5 years earlier. So in effect, the municipal respondents are actually saying no, like the majority of them are saying no, there is no overpopulation issue. And so I think this is a really important point that you'll hear a little bit more about, is that we have differences in perspectives that are coming out through these stakeholder groups. And it maybe bears reminding that municipalities responding to this survey have not all necessarily been involved with actually managing and operating shelters. So municipalities often will contract out their services to other groups in their community to do that. And so they may not, many of them may not actually be facing the direct effects of overpopulation. We then wanted to know about how groups in their communities were addressing overpopulation where they felt that there was overpopulation. And we offered a list of tools involving all of these different options and asked, which of these do you have in your community? And what we see here is that humane education is an area where many people responded that they have a humane education program towards addressing cat overpopulation, and that increased relative to 5 years ago. But the other major increases are in the TNR programs, more TNR programs being put in place, and I also wanted to talk about the fact that fewer people are saying that cat euthanasia is an approach that's being used to address overpopulation compared to 5 years ago. The next aspect of the question is, what do you think, how successful do you think these practices are in your community? And again, on the labels here are the same options that were provided earlier, and people were asked to rate their success on a scale of not at all successful to very successful. Overwhelmingly, high-volume spay-neuter and subsidized spay-neuter were identified as being the most successful. And we can also see an increase in their perceived success relative to 5 years previously. There's also been an increase in most of these other practices as well, and euthanasia is the exception. It's not deemed to be more or less successful. So clearly, more people are having experience with some of these accessible spay-neuter initiatives, and they're finding that they are successful. And so the question now is, how does that translate into what we're actually seeing cats coming into shelters and their state of sterilization? Are they coming into shelters? Are they being taken in already sterilized, or are they still intact? So I'll focus on, again, the middle section here. For cats initially, what we see, actually, focusing on the bottom row, these are the total number of cats and dogs coming into the shelter. And in 2016, for that entire calendar year, 13% of the cats that came in were already sterilized at the time of their intake. And that's about double what we saw 5 years previously. Similarly, for dogs, the number who are coming in, or the fraction that are coming in already sterilized, has doubled relative to what it was 5 years previous. So again, speaking to the fact that more sterilization services are being offered and are being used. If we break down that total by owner surrender versus stray, so how do those animals, how are they characterized when they come into the shelter? Again, across the board, we see generally a twofold increase in terms of the sterilization status. And not surprisingly, perhaps, the animals who are coming in as owner surrenders have a higher, there's a higher fraction who are sterilized at the time of their intake. But I would say that these numbers are still pretty low overall. So for those animals who are not coming in already sterilized, animal care organizations can provide sterilization, and most of you already know this, do that as a matter of policy. When asked whether organizations are providing sterilization to adoptable animals, animals that they're adopting out to the public from their facilities, almost all of the organizations said that yes, they are, from the Humane Society, SPCA, TNR, and Rescue Group. However, the one outlier that we see here is the municipal group. So only 19% of municipalities indicated that they sterilize their animals prior to offering them for adoption, or actually that they sterilize their animals. And I actually just wanted to make a clarification on this because 19% is extremely low and quite surprising. However, if we look at this next slide, which shows another question that we ask, do you offer animals for adoption from your facility? I just want to point out that the municipalities, actually less than a third of them say that they offer animals for adoption, whereas all of these other groups, almost all of them are offering animals for adoption. And so I just want to clarify that because what that means is that when we see, when we look specifically at the municipal groups who are offering animals for adoption, this number actually goes up to about 55 to 60%. Still a long way to go compared to the 100% or 95% of the other organizations, but perhaps not as shocking as the 19% that you first saw. So still a lot of work to be done, though, at the municipal level. And when we ask which animals are being sterilized, or ask a little bit more about those who are getting spayed and neutered prior to adoption, this slide shows, in particular, what is the fraction of animals who are juvenile. For cats, 48% of those who are being spayed and neutered are kittens or juvenile. And compared to 5 years ago, when that was 25%, that's a pretty big increase. Similarly, dogs, 19% of those who are being spayed and neutered prior to adoption are puppies, and that is just a slight increase, I would say, relative to 5 years earlier. So there's a lot of effort there in terms of the number of juvenile animals that are being spayed and neutered prior to adoption, which is great, and we'll talk a little bit more about that. This slide is the summary of a question of how, or what is the earliest age that you perform spay and neuter on the animals that you're going to be offering for adoption. And so by month, we see a range from 2.4 at SPCAs to as high as 3.6 at rescues and 4.0 at TNR groups. So just again, focusing on the cat row, 2.4 is the lowest that we're seeing among these stakeholder groups, and that's at the SPCA level. I want to point out that the SPCA stakeholder group actually is composed, 2/3 of respondents are branches of the BC SPCA. Just the way it worked out in terms of if you look at where those SPCAs are responding from. And that organization has a policy For the branches in which there are veterinarians present, they will be offering, if possible, sterilization as young as 8 weeks of age or 2 pounds, 8 weeks of age or 2 pounds of weight. And so many other SPCAs and humane societies may also be doing this, and in fact, it is a best practice that is being recommended by many organizations, including the Canadian Veterinary Medical Association, among others. The Association of Shelter Veterinarians released a guidelines document in 2016 for spay-neuter programs in organizations that are adopting out animals. And their recommendation is, in order to ensure that every animal actually goes home already spayed and neutered, and therefore improves the likelihood that there aren't going to be additional litters being produced, that that can be done as early as 6 weeks of age. And in fact, sterilizing early also increases the likelihood that that new adopted animal will be retained in their adoptive home, because being intact is the leading risk factor for relinquishment. Okay, so we've been talking a lot about spay and neuter, and I want to do a quick summary here. We saw that a higher fraction of the general public reports that they've had their animals spayed and neutered, and again, there were some caveats there. A higher proportion of cats are coming into shelter already sterilized, and more adopted animals are being taken home already sterilized. I want to say that these are definitely improvements, but there is room to do better. As well, fewer municipalities are sterilizing adoptable animals prior to adoption. So again, close to 55–60% compared to 95 to 100 in the other categories of stakeholder groups. As well, a higher proportion of juveniles are being sterilized, and I didn't actually show a slide on this, but it turns out that shortage of funds is no longer the reason that animals are not sterilized prior to being sent home for adoption. So we asked a question about what the top reasons are why an animal doesn't go home already spayed or neutered, and it turns out that 5 years ago, 20% of the people indicated that lack of funds for spay-neuter services was the main reason, whereas in 2017, only 4% were reporting that lack of funds was the main reason. And so I think this again speaks to the increased number and increased availability of spay-neuter services that are out there and being used. The next section of the survey goes into intake at animal care organizations. So how many animals are coming in to those organizations? And in 2017, or actually for the full year of 2016, 114,000 cats and some 47,000 dogs were coming in. On a per organization basis, this works out to about twice as many cats as dogs. And here's an important point, I think. Out of the cats that are being taken into these organizations, 43% are juvenile, meaning that there are a lot of unwanted litters being produced, a lot of unwanted kittens. So if we looked at the breakdown of the animals coming to shelters, we've been finding year on year, and same with 5 years ago, that approximately half of them are coming in as stray animals, a quarter are coming in as owner surrendered, and a tenth are being transferred in. The top reason given for owner surrender continues to be housing issues, so having difficulties with landlords or cooperative property management, that type of thing. And when we look at the ability, the capacity of organizations to take in animals, we can see overall 73% of capacity collectively was being used in 2016 compared to closer to 90% 5 years earlier. Breaking that down by stakeholder group, we see that overall less of a shelter or a facility's capacity was being used compared to 5 years earlier. The difference, a couple of differences. One, rescues. They're not typically using shelter kind of housing, so that could be part of the reason. But overall, we're seeing some big changes, especially in the SPCA group. So once again, I'll just mention BC SPCA is making up a big fraction of that group. And they were the first organization in Canada to implement the capacity for care approach that has resulted in being able to better meet the capacity of the shelter with, better match the capacity to the number of cats that they bring in, and also results in cats not overwhelming facilities, not overwhelming shelters. And so more and more organizations are putting in place capacity for care, and I think that's part of the reason why we're seeing this shift. What animals already had ID at the time of their intake? This is, I think, some good news. In 2011, and actually this table is speaking about the inverse, the number of animals who came in without ID. In 2011, 63% of cats came in with no ID, compared to 46% of dogs. And 5 years later, we're seeing quite a significant decrease in the number of animals without ID. And interestingly, these are starting to match up a little bit more. So I find that interesting. If an animal doesn't come in with ID, organizations can provide permanent ID options. And overall, we're seeing generally a little bit of an increase in the number of organizations who are doing so. The outliers being the municipalities, who only 43% are offering a permanent ID, so I think there's some room for improvement there. And also the TNR groups, who are operating on a slightly different system, and also we had fewer responding. Providing ID allows for improved reclaim rates. So we wanted to know how many animals out of all of those coming into a shelter were actually being reclaimed and going back home. And we found that in 2016, it's still only 10% of stray animals who end up going back to a home, versus 68% for dogs. So that's a huge difference, and it's one that we see year on year. So a couple of points there. I think it may be important to consider, what are stray cats? Are they actually, the cats that we bring into shelters or into facilities and we call stray, are they actually lost cats? Could some of them be living in the community or being supported by multiple households and not actually be missed when they go missing or when they aren't seen for a few days? And what is the effect of bringing in a lot of stray cats into the shelter where such a small number will actually end up going back to a home that is missing them? Okay, apart from going back to a home, another fantastic outcome for shelter animals would be adoption, of course. And so here is some fantastic news from the 2017 survey. We found that over the course of the calendar year 2016, cats, out of all of the cats coming to shelters, 60% were adopted, compared to 43% 5 years earlier. And for dogs, the percent adopted also improved, but not quite as dramatically. So that's fantastic, and I think it speaks to the fact that more shelter animals are experiencing better outcomes than they did 5 years ago, among other reasons because the euthanasia is also decreasing. So this slide shows that for all of the animals coming in for the calendar year 2016, for cats, 18% of them were euthanized compared to 40% 5 years earlier. And for dogs, 8% compared to 14%. So right there, 40% euthanasia rate down to 18% is phenomenal. And if we look at the fraction who are juvenile, it's still, out of those animals that are being euthanized, there's still close to a fifth that are juvenile. Again, speaking to unwanted litters, unwanted kittens, and the need to address that. And what we're seeing in 2017 is that for cats, 94% of people are indicating that the reason that cat was euthanized was because of illness or change of health status, compared to other reasons such as animal behavior, affordability of medical treatment, and lack of space in the shelter. All of these other reasons went down significantly. So shelters apparently are not as crunched for space or are not taking in animals where they have no space and needing to euthanize them. It seems that veterinary services are more available. And interestingly, animal behavior is not an issue. So maybe cats who are not adoptable because they don't have those behaviors that are conducive to adoption are not being brought in. As well, there are other programs for cats that have behavioral issues, like working cat, barn cat programs, that type of thing, which I think could be employed more than previously. And just a quick note to say that the difference for dogs is just, rather than illness and change of health status, animal behavior turns out to be the primary reason that dogs are euthanized. And I think, part of the reason for that, we have fewer options for dogs with behavioral issues, and of course, that would probably also include dogs who are deemed to be dangerous. On the side of the veterinary stakeholders, we had, as you know, private veterinarians who were participating in the survey as well, and we asked a little bit about what kind of support they're providing to support cat overpopulation problems among organizations in their communities. And we found that, for the most part, vets are supporting rescue organizations and shelters, but rescues more so now than they did 5 years ago. So 5 years ago, it was kind of split. And interestingly, cat services and dog services are essentially being provided almost equally by these veterinarians who are supporting their communities. And it turns out that if we ask about how much of your resources or time are you donating to support those organizations, on average, 11% is what they're providing, which is fantastic. The level of discount that they offer on their services ranged from 30 to 45%. And typically the services provided include spay-neuter, as well as medical treatment and testing, as well as vaccinations. So I want to give a summary of these results. I have to say that the full report has a lot of data in it, has a lot even more than what I've described, and I had to keep this down to the real salient and critical findings. But as we talked about, a lot of the good news that's coming out of our research from 2017 is on the area of spay-neuter. And first of all, the fact that more people who are in, say, good demographics or high-income demographics are aware and are, if they're not, well, certainly getting the message about spay-neuter and hopefully translating that into action. More cats are being admitted to organizations already spayed and neutered, and that's through all of the work of these organizations as well as owners. Availability of accessible options has increased, and more organizations are sterilizing prior to adoption. Juveniles making up a large proportion now than they were 5 years ago. Lack of funds, no longer the main reason that animals are not being sterilized prior to adoption. And of course, more cats being sterilized in general. The critical pieces of great news that came outside of the spay-neuter section are that far more cats are being adopted out of animal care organizations, so they're having better outcomes, and the euthanasia of cats has drastically decreased. So all wonderful findings. However, there's still some negative aspects to the findings that we had as well. And I think some of these come out when we make comparisons between dogs and cats. So there's still twice as many cats coming in, homeless animals coming into organizations compared to dogs. And the proportion of those cats that are juvenile is very high in comparison to the proportion of puppies coming in. So again, speaking to this need for addressing the production of kittens who are not wanted. The rate of reclaim for stray cats is still and consistently has been 1/7 that of stray dogs. And, euthanasia is down, but still 18% of cats are being euthanized compared to 8% of dogs. So, as always, and first and foremost, education about responsible pet ownership and spay and neutering, the importance of that, and the cruelty and illegality of abandoning animals is always part of the actions that need to be taken to address these issues. But I think we could say that perhaps we need even further education about early sterilization to address those unwanted litters being produced. Accessible spay-neuter, we've seen some good advances in that area, but there's still more work to be done. And in particular, I think we need to think about who's funding accessible spay-neuter services. Typically, it's charitable organizations who are being supported by their donors, being supported by veterinarians. What about the need for the government sectors to get involved more in providing that, and perhaps linking that to some of the bylaw and licensing activities that they undertake? As well, we talked about the importance of early age spay-neuter and the Association of Shelter Veterinarians guidelines. So these should be adopted across the board by organizations who are adopting out animals, and we saw that municipalities are a stakeholder group that has a lot of improvement to make in that area. As well, all sheltering facilities incorporate capacity for care, should incorporate capacity for care into their management practices in order to improve outcomes for cats. And I wanted to just say here that what's important is in a community there may be many different types of organizations participating. And where, for example, Humane Society is putting in all of the effort to implement capacity for care, other organizations in that community need to be supportive and working in a coordinated way. Otherwise, we may not see real results, but just shifting of the problem from one part of the community to another. And so this point is really speaking to that difference in perspective that we saw among the municipal stakeholder groups, where they felt much less that there was an overpopulation issue. We feel that communication across those different stakeholder groups is going to be key to figuring out why there is that gap in perspective, first of all, and hopefully to leading to more collaborative approaches to be able to address the outstanding problem of cat overpopulation that we still have. So more strategically working together in coordinated fashion and integrating more holistic approaches so that in one community, all of the organizations implicated in cat care and cat overpopulation issues can be working together. So this is an area that CFHS is going to be focusing in the coming time, engaging more, in particular, with the municipal stakeholder groups as a result of the results of the research findings. Okay, so what I was hoping to do, what I had hoped to do, was to be able to give all of you a few minutes at your tables to discuss these questions. But perhaps I'll just put them out there for you to think about individually. A lot of data there, a lot more there too, if you want to dig deeper into the report. And actually, I wanted to mention, in case I forgot, that the 2017 Cats in Canada report is also now available in French for your francophones in the room and colleagues at home. So what were the key take-home messages for you? And where do we go from here? How do we get to addressing that. We've seen great progress in the last 5 years, but there's still an overpopulation issue, and what do we need to do to really tackle that? So I would be welcome if anybody would like to specifically address one of those questions, and or if you have other questions, I'd be happy to answer those as well.
Thank you for that. That was amazing.
Thank you.
I was wondering if you could speak specifically to the lack of attention that's given to returning stray cats to their guardians. So there tends to be like a great push and attention that's given for adoption, and yet here we have this huge burning issue of cats not returning home to their guardians, and why, what you could recommend there.
Yeah, so I think there's a few different issues there. And if we're talking about the number of stray cats that are actually being reclaimed, one point to take in mind is that perhaps some of those cats actually don't have ID on intake and don't have a home to go back to. Perhaps they are among that community cat population that isn't actually associated with a single household. So more engagement of people to actually provide permanent identification is absolutely an aspect where there are cats that are stray, that are brought into the shelter. But then there's the complicating aspects of the cats. If they are lost from their home, they may not actually be out and about walking around to be picked up and brought back to the shelter. They may be in hiding, particularly if they're an indoor cat. And so by the time they get out into the, walking around trying to find resources and shelter, et cetera, maybe it's been so long that people aren't looking for their cat anymore. So more effort also then needed to help people to understand when their cats go missing, why that, what their behaviors are likely to be, when they should be looking around their neighborhood, when they should be looking into the shelter, and continually going back. So yes, I think there needs to be more education in general on that side, as well as some contemplation about whether it's appropriate to be bringing in every stray cat that's walking around comfortably outside and looking healthy, and whether they actually do need to go back to a single home, or whether their home is out in the community. Hi.
Hi, thank you very much. I know in our area, one of the things that I think could be challenging for us is in Fredericton itself, would be getting vets on board to do the spay-neuters at 2 pounds or 6 to 8 weeks of age. So maybe sometime during the conference we could collaborate a little bit on facing those challenges and how to bring that around.
Absolutely, I'd be very happy to speak more. And in fact, I talked about our focus being on working more with bridging the differences in perspectives with the municipalities, and CFHS also wants to engage more with the veterinary community as well. And yes, I'm around for the next 3 days of this conference, and very much want to hear from all of you about your experiences and what's resonating, and where do we need to work further together. Thank you so much for your interest. Yeah, if we don't have a chance to talk over the next few days, please don't hesitate to email me anytime, but I hope that if you have any questions, I would love to speak. Thank you very much.